viewers, welcome to UKN TV. It's Diaspora Speak. And a lot of you, we've been talking about mental health. Mental health, mental health. This is not going away. But for us today is mental health for our people and our young people. We have the one and only, the best profession we have in the UK, who have also done a lot for Kenya. So we had to reach out for Bridget Maingi. So Bridget, welcome to the program.
Thank you so much for having me.
Tell me a little bit about Bridget. Who are you? What's your professional background?
Oh, thank you very much. You want to know about myself?
A little bit, yes.
Okay. Name is just as you've called me, Bridget Maingi. That is my name. Mental health clinician. A very passionate person about mental health. I'm a corporate mental health facilitator. I'm a first aider, mental health first aider. And above all, I'm the founder of Think Out Loud, Let's Talk. Is a community-based organization in Kenya where we raise mental health awareness and support people suffering with mental illness, suffering with substance abuse, and alcoholism. So when you see Bridget, those are my titles. That's me.
Wow. Viewers, you've had Think Out Loud, Let's Talk. And that is why we're here today to really let's talk. Mental health, as Kenyans, in fact, as Africans, we don't talk a lot about mental health. Why do you think that's the case, that we really are stigmatized about mental health?
Yeah, thank you very much for that question, because this is a question I hear many times coming on and on. Time and again, people asking, why mental health? Why mental health is because this is one part of the body that has not been seriously taken care of. This is one illness that has not been addressed. And if you allow me to say that, so many illnesses have come in our life. We experienced when HIV was coming, how much it was handled, immediately taken good care of. We had COVID just the other day. That was declared as pandemic in the world, and a lot was done. Sadly, mental illness is a very, very old illness, but it has never been taken seriously as anything else that is being well taken care of. Now, during 2020, 2021, when COVID struck the world, every scientist, every doctor, nurses, everyone, name it, they were out there trying to work to prevent this and trying to get the vaccines we had, and it was controlled. What they did not know is the impact of COVID and the people on mental status. People became mentally unwell. People worried so much about COVID, and that affected their way of thinking, and as a result, they became mentally unwell. Today, I can assure you, we are seeing the fruits of COVID on mental health side. When I say fruits, it doesn't mean good fruits that we are eating. We are seeing negative outcomes of what happened. Because of these worries, the fears people had, how that impacted into their mental
But most
well-being.
of us have not been using the word mental health. I mean, we've just been going on, I'm not feeling very well, my mood is down, there's a little bit of, I feel a little bit depressed, I don't know whether it's depression, I just want to sleep and cover myself. So most of us have not had to reach out for help. And that is a point whereby a lot of people don't understand mental health. So if you want to talk to the viewers, what is it mental health? How can somebody be diagnosed with mental health? What do they look for? As a clinician, what do you look for?
Okay. Mental health is not a diagnosis. Everybody needs good mental health. But the mental health illness is the problem. People get fears. People get worried of things they don't know. People are stressed. How many times do you hear people saying, I'm stressed, I'm stressed?
I've been stressed.
Exactly, we all get stressed. The problem is, how do you handle the stress? How do you manage your stress? This is where, as professionals, we come in to help you who is stressed, because we don't all handle stress in the same way. There are some people who get so stressed that develops to become anxiety, or to become, it's a fear that you cannot be able to explain. You are scared of something you don't know, and before you know it, you are depressed. You become mentally unwell. So people don't like to talk about mental illness simply because of something we call stigma. The stigma in mental health is so strong than the one you saw on COVID, when people were going against one another because, oh, they don't have vaccine, they are not vaccinated, I'm not with them, this and that. Mental health is a big thing. People don't talk about it. People don't want to associate with the people who are mentally unwell. And guess what? Even your family will push you away when you're mentally unwell. Because when people hear about mental illness, they see murderers, they see violent people, they see people whose personal hygiene is not good. This is what people see. Sadly, so many people suffer in silence with mental disorders, and they don't get to seek help simply because they don't know what they are going through. They don't know whatever stress they have got, how much impact it has got in their own brains. So that is why it is not well talked about, and this is why we help people. As a talk therapist, I help people to dig deep the cause root of the stress, and then we can manage stress when it can be controlled before you get to hit the rock bottom and say depression. Depression starts slowly. If you can be able to get help before it gets worse, it is the best thing to do. Unfortunately, people suffer in silence until they break down, and then that is time we go, pick them, take them to the hospital when they cannot do anything for themselves. So we advise people to try and seek help when it is the right time to seek help.
Well, it's easy for you to say that because you're a clinician. You would know that time where they need to seek help. I'm asking you this question because I know you would know. As a mental health clinician, who are your clientele? What kind of patient do you see? I mean, would you see people in the community and think, okay, that one needs mental health support? Number two, what is it that has increased? Because I think in the last decade, we've seen such a huge increase of mental health suffering with a lot of people. Why that increase?
Why that increase? That's a good one as well. Why increase of mental illness is because the world is not changing, but the world is developing in so many areas. I'll give you a simple example, something I've been thinking about in the past few days. I've been abroad for 2 months, and this is what I've been doing. I've seen so many of young people. And this, by the way, Janet, these are the people we need to focus on to more than anybody else.
Young people in Kenya?
Yes, not in Kenya only, even here. Young people, I just mentioned Kenya because I've been there and I've seen the suffering, the struggle is the same as here. We have got so many young people who have come to this country. Do you want to start with that one or the ones back home?
Both of them, because they're important. Yeah.
Exactly. And this problem is same and one, but people don't know. People who are back home are struggling because they don't have jobs, which is understandable. Without a job, but they are not focusing on doing anything to help themselves to get employment.
Well, as somebody with decades of understanding of mental health, being a clinician for so many years, we have been talking, me and you, because we link up when it comes to young people. Whether we are talking about young people in the UK or young people in Kenya, what is your observation as a clinician? What has caused the increase of so many of them suffering from mental health?
Okay. Young people in Kenya or in UK are young people. They are the same. The problem is the same. People start with talking of stress. But as a clinician, what my observation is, there is a lot happening in the world. So many things are happening. There is global warming. We had pandemic just not long time ago, and that affected so many people. Name jobs, families, and education. So many people were affected when we less expected because no one prepared us for pandemic. But as professionals, we worked everybody at their own pace to the best we could for the communities. Unfortunately, young people were not prepared, and it got them when they less expected. So the jobs became minimal. Some who were on education because of being away for too long stopped the education. That also affected people. Then there was people whose jobs got lost. They don't work anymore, and they were not able to continue with what they were doing. So this is affecting people. When I talk to young people, or what we get more from young people is stress. You can see somebody being brought to the hospital or being brought to your care. Support these people. When you talk to them, they are telling you, I'm stressed, I'm stressed. When you try to understand the stress, it is more than stress. And they are not able to expand further or to dig deep where the problem is.
And as parents, we're like, pick yourself up. So there's no outlet, isn't it?
There isn't. Easy to say, pull yourself together, go search for a job. They don't do that. When they are asked to go and look for jobs, where are they going? They are going to seek comfort. The comfort is coming from alcohol and substance abuse. That is why we have seen so many young people on drugs, on alcohol. There are those who are just smoking weed. There are those who are just all the time. And what do you think, how much those people are doing? How can they do a job if they are not in sober minds? So for us, what we are trying to do, me and the team, obviously, is to bring young people together, just work with them to help them understand themselves and to understand the problem is bigger than they think if they cannot change their ways. Yes. So it's just to guide them, help them to dig deep the problem. How did this start? Then we work on that. When we work small steps, we can get somewhere.
So finding the way for the young people to self-regulate, that kind of training in Kenya, let's say, for example, because in the UK, I know those were in the school system, those were in the university, there's always a counselor allocated somewhere who will do a lot of observations. Teachers are supposed to put in the system safeguarding when they see there's an issue going on. Are those steps in Kenya visible? Are the parents aware when to pick up these signs of mental health?
Oh, thank you very much. That's a good point you have raised there, because the system in UK is completely different with what we have in Kenya. I've been going to places, do you know, even workplaces, even schools, colleges, universities, very minimal help is there. And people are not even given an opportunity to identify the problem. They don't have people to work with them to identify the problem. Come to schools, the parents are not aware of what children are going through. They think it's change of behavior. They think it's peer pressure. Anyway, all these are there. Yeah. What they don't pick, there's more than that. When children start withdrawing from school, when children start behaving in a way they never used to do, parents are not aware of changes affecting their children. They may think it's age, they may think it's peer pressure, but it is good. Exactly. But it is good to try and dig deeper what is happening. Children are using drugs in schools, in colleges, in universities. Parents don't know that. And if you are to approach a parent, tell them they need to support their children to get proper education as they want, and you mention mental health, that's a big problem.
Mental health and drugs. Why are you trying to say my child is taking drugs? There's that anymore. The parent will not see. The child is always an angel where that is concerned. Exactly. And I think that point you've raised, like how we as a community do not know much about what our children are accessing. I mean, let me bring an example of social media. There's so much things because the influence of social media and these influencers showing how fantastic their lives is. Yes. They're not doing anything sensible in their lives and they're doing very well. A lot of young people just want to have a lot of money very quickly.
And they haven't worked.
And they haven't worked. How do we go through that? Because that's our mental health issues. How do we go through that hurdle? Because it's not one young person. There's a lot of young people who think there's a lotto somewhere you can just win. How do we now navigate that bit where they think, I just want to get rich?
This will come with being open and honest with our people, with our children, with parents, being honest with them, to tell them things are not right and something needs to be done now than later. You see those people who want to be rich so quick, yeah, and they haven't even got a job, they haven't even finished their education, but they're still going into that. This has to take everybody working on this. Yes. And system need to be put in place. We may not force the government to put the system in place, but we as parents, we can do something better. You see, bringing these people together, talking to them about the wealth they want. The wealth you have got, you didn't get it when you were young. You have worked for it. Your children need to know how to work. And I think I'll mention this on a personal level. As parents, we have failed our children because we are not giving them responsibility when it's supposed to be. Children come and ask for money. Any money they ask, you give them. You don't know what they're spending this money with. Yeah? And they do things that are contrary to what you'd have wanted your money to do. Yes? Within the time I've been in Kenya, there is something I have done, and that really made me sad. There is a lot of, let me say this, and I hope I'll not be in trouble for saying this, gambling.
Yes, gambling, yes.
Radios.
Shockingly.
Yeah, radios, TVs, they are always announcing. So they may not call that gambling, but me is a gambling. You put 100 shillings, within 3 hours, we are giving out 1 million. People are flocking their numbers. Yes, they get some, so and so have on 1 million. So they want to, I said to some people, some friends, I told them, this sounds better for you guys. You are chasing it, but what you don't know is the big problem lying behind this. It is a big thing. There's no difference between this and going to casino. Yeah? But now we want to know this. Now young people are asking for money to do that. The young people are doing cheap jobs. Yeah, even they will be able to wash clothes, to get 100 shillings, to send to this and that, to get this a lot of money. Why do they want this money for? Why do they want too much money? And this money they haven't worked for.
Money addiction, isn't it?
This is an addiction. So when they don't get that and now they don't have money, where are they turning to? To drugs and alcohol. If they get all this money again, where are they turning to? Because something is lacking. Their brains are not functioning in the right way. We have not helped them to mold.
We have not invested.
We did not invest on them, or we are not investing on them enough. I wish every parent can desire to invest on their children. And having said that, I also said something I always tell my colleagues and my friends. Single parents are bearing the heaviest burden. Very, very big. Because I would say what I have seen with single parents is they want to please the children. And when they are looking forward to please their children, to bring them up in a better way than they were brought up, it is causing a problem. And those children are turning to be the addicts, the drug addicts, the alcoholics, because they had too much than they could bear.
In our usual
Do you
talk,
see this is also coming from the way we think and the way we see things?
we've put it into our children. But from my talk and your talk, I've been a little bit overwhelmed by the issues you have dealt with in Kenya. A lot of suicide cases. You even have to go to universities and give talks to students who are yearning to get a counselor. There's so much of those kind of death and suicide of their friends and things going on that young people are not prepared to deal with. Tell me, how do you feel these young people can be helped better? Because with those kind of suicides, we're losing children.
Yes, we are. We are losing many children, not only in university, even colleges, even at home. As I said, what is lacking is the people to deliver that. One, counseling is damn expensive. And we don't have those programs like the ones we start here. Yes. We start a program today, it's sponsored, it got well wishes, and we support people. People come when they are struggling, when they are going through issues. It is long time, of course, here people do kill themselves as well. People end their lives. Yes. But it's very rare you hear cases like, oh, the girlfriend left him and that's why he has done this. It has to be a case that has been ongoing. Because when the girlfriend or when the boyfriend left them, they had a place to go and meet. They come to us voluntarily, or they go to seek help, or maybe they search on social media. There is help out there. You know, we have got like Minds. We got all these mental health organizations where people go in private and just chat to them, or you can call Samaritan.
For a person to take themselves from their home to actually walk to go to a mental health clinic in Kenya, or even in the UK, to be honest, where are those clinics? Viewers, what we are saying here today, we have a job to do. What Bridget is saying, we have counselors who are willing to actually do much in Kenya. What is the hindrances?
the hindrances is, I would say, is based on my own experience. When we go there, it is not easy to interact or to engage with the professionals on the ground. I don't know why, I don't understand why they don't want to work with us, yeah? And somehow they see as if we are coming to interfere with their business. But some of us are just well-wishers. We just want good for our people. We just want good for our country. We just want to support them. Even those clinicians in those countries, those therapists, those, name them, psychologists, we just want to work with them. We want to support them as well.
But they're quite accessible for the rich person. If you are rich in Kenya, you can access a counselor, you can access a clinician. What about the many? Because 80% of Kenyans are not rich. The common mwananchi who might be suffering from mental health, who will even pick that up, who would go to that school and pick, okay, 500 people in this school, these 3 need a little bit tender love and care. Who picks those up?
I don't have an answer for that, Janet. But
What can we do? Because I like to find solutions.
This is it. What I would be honest to tell you, even those you think rich and have got money, they also end their lives. Their children also suffer. Yeah? Even the rich cry.
Yes.
Just because there is not that knowledge. There is no knowledge of, or there's no better understanding of mental illness. And the psychologists I've met, personally, when you tell them of mental health, they talk about drugs and substance abuse. That's what they know. It's
a blame game.
That's what I don't deal with mental health. I deal with this. I don't think it's a blame game. I think the knowledge is minimal. It's not what we have. We don't see wider area of mental health. When we get fixated, he's on drugs, he's on alcohol. We don't dig deep to understand. Could there be a mental health, a mental issue there? Could there be a mental disorder? They don't do that. And I trust you, I've met many senior counselors who tell me they deal with that. I would encourage everybody to get basic understanding of mental illness. When you identify basic mental illness, you'll be able to support your own and to support yourself. This basic means a lot because that is where parents will identify their children are starting to get up late to go to school. They don't show more interest of things they used to do. They are unkempt, not necessarily unkempt, but they are starting, so-and-so used to be very neat. This is changing. Identify those small things.
They're quiet. Maybe they used to be chatty.
They could be very chatty or they could be quiet. They are withdrawing. Or they could be wild. They could be going and they are partying out there. Something they never used to do. So mental illness doesn't have this way or this way. It is either. Like, for instance, there is a diagnosis called bipolar. Bipolar, people can be manic and they can be very low. They can be very chatty and the next minute they are withdrawn completely. Such things, we don't want people to give diagnosis to anyone. We don't want you to diagnose yourself. Just tell yourself something is not right. And having said that, I'll tell you about this clinician sitting with you here. When I was growing up, there was so much going on in my life. And I lost my parents when I was young. And I became a teenager mother. This is a long story. I'm not going to tell you now. There is time for that. So when I am a young mother, a young single mother, mind you, young single mother, and an orphan. Can you see that cocktail? Yeah. I was going through so much. Today I look back and I realized I was so depressed and I did not know. Janet, if what I know, I knew those days, I would have been diagnosed with schizophrenia. Schizophrenia is an illness. It's a serious mental illness. Where
I've seen that.
Have you seen that?
Yes.
Do you see people who walk talking to themselves, hearing voices?
So they are going to kill that for this.
Do you know I've been told that by my close friends? I used to talk alone. I was conversing with myself, and
is that coping mechanism or what were you doing?
It wasn't a coping mechanism. I didn't know I was talking to myself.
So how do you turn
What I know is when I'm sleeping, when I was sleeping those days, I used to hear these voices, a very big voice like a truck stuck somewhere. you know, endless.
Yes.
And then I could hear, you know, the goats, those who have got those big bells.
Yeah.
I could hear those bells. And you know, I used to scream. Janet, that's God in heaven. I'll tell you that story another day when I'm not in a hurry. But I know I was mentally unwell.
And you turned around.
I turned around.
So what you're saying, there's a turnaround if you get the right, even the right, I always say sometimes you need catalyst around your life. For example, in the UK, when you get into a career path, sometimes you realize the only thing that, especially lack of money, is a big one for our people. It's a big one for our people. And those kind of stress and those kind of anxieties can lead to something quite big. So I'm telling you, viewers out there, if you're listening, when you talk about mental health, it's a vague area. For a lot of us, it's quite a vague area because we don't know how to approach, we don't know how to deal with it. If you ask me right now in my house to identify any of my child or my husband or even me, what I'm going through to suggest that there could be some mental health going on there, I might not want to be labeled like that. But it's not really a label. And the world we are living in today, there's so much competition, there's so much fakeness that you would end up feeling like a failure. And that is the challenge we're having, whereby young people are not fully developed in their brains to know this person has got their own path. The other person have got their path. Let me sort out my path without comparing. And that kind of mentoring needs time. It needs somebody to counsel and correct and mold. And that is what we are missing. So don't just listen and watch your child going down. Find a way to access a clinician like Bridget. Some of us are just a phone call away. You just have to call and we give you some ideas. What can you do in such a situation? But don't stay waiting for a good day, because those good days you're waiting for might never come. There could be just a journey going down and you could have stopped it earlier if you took that phone and said, for my child, for their life, I'm gonna just forget about being that person, because in our community we don't want to be labeled. I'll forget about the label. I'll seek help. Yes. How can people access you? How can they seek help from you?
Before I say how people can access me, I want to reassure everyone, mental illness is preventable. The most important thing is to understand to your body. Listen to your body. Identify when something is going wrong. When you are able to do that, you can prevent yourself from going down. My name is Bridget Maingi. My contact number is 07868356195. I'll repeat that. It's 07868356195. You can also visit our website, www.thinkoutloud.org.ke. That is our website. You can access tools and sources to support yourself. Thank you very much. Think out loud. Let's talk.
Well, viewers, that is, and I did not just search for Bridget. I have heard of her good work. I've seen people she has raised from deep down when they're going through a deep place to somebody who's coming up professional and doing very well. There's so many good examples that you just have to be strong enough and say, I will rise again. And you know, for me, First of Kenya, we run and say, no young people is left behind. So let's make sure that wherever you're standing, if you can support financially, find a way to support one person even in Kenya that will, or even in the UK, support somebody rise up. If you can be that person who's a professional and you want to be part and parcel of what Think Out Loud and Speak is talking about, be that person. Because sometimes you only need one day within your month to be the voice that that one person is needing to rise up and stand. No more mental health, no more stigma of mental health, and let's say me and you, everybody listening to this, we can save our generations.